All right, hello, welcome everyone to Phoenixville Library and tonight's presentation, Medicare 101, the basics. We are pleased to have with us tonight two counselors from the PA-MEDI organization, Harry Ting and David Hardgrove, who will be presenting jointly tonight. So folks, take it away.
Okay. Well, thank you, Mark, and thank you for the library for hosting us. And today we're going to go over the basics of the Medicare program, and hopefully this will give you enough information to get enrolled in Medicare, and then if you have questions about it as you are experiencing the program. This may answer some of your questions, but we're also available to answer your questions in the future as well. So we have two presenters today. My name is Harry Ting. I'm a PA-MEDI counselor. I've been doing this for, I think, close to 10 years, maybe 9 or 10 years. David Hardgrove is our other presenter, and he's been doing it around 8-9 years as well. So what's PA-MEDI? PA-MEDI is a program that's sponsored by the Chester County Department of Aging. It's also a program that's operated throughout the state of Pennsylvania, and it's a free counseling service that's offered to people who are interested in Medicare because they're enrolling in it or they're dealing with the Medicare program and have questions. So we are trained and certified to provide you with information, and one thing that is nice about using us is we don't get commissions on you choosing one thing or another thing. We're totally unbiased and independent, and so you can count on us to give you honest advice. This slide shows two ways in which you can contact us after today. One is, I'd point to the second part first. For questions, you can call our hotline, which is this number, 610-344-5004, option 2. And what you do is you leave us a message saying you would like to speak with us and giving some information about what kind of question you might have. The other thing you can do is you can actually see us, meet with us in person, and particularly if you have a question where we need to spend more time with you and go over maybe different plan options, things of that sort. We do see people at the senior centers in the area, and there's in your packets is a list of the senior centers. Also, we do counsel on some other sites as well.
I just want to mention we do counseling here at the Phoenixville Library as well on Monday evenings, for those of you who work during the day.
Okay. So these are the things that we're going to cover today. We're going to talk about what the different types of Medicare plans there are. There's A and B, there's Medicaps, Medicare supplements, drug plans, Advantage plans. It gets very confusing, so we'll try to help you understand all those different options. And then talk about how to enroll, what you have to do to enroll, and then talk about if you are going to be working past age 65, you may opt to enroll in part of Medicare, but not all of Medicare, all the Medicare options until you retire. So we'll be talking about all those things. First thing we want to make sure that you understand is there's a difference between Medicare and Medicaid. And Medicare is a program that we're going to focus on today. It's a federal program. It's been financed through your payroll taxes that you've paid in as you've been working for the many years. And it helps to pay for medical services for senior citizens and people who have certain disabilities. Medicaid is a program that's administered by each of the states, and each state has different rules. So if you know someone who in New Jersey and they say, well, our Medicaid program does this, doesn't necessarily mean that that's the same in Pennsylvania. So each state has its own rules, and it helps people who with medical services as well, but it's designed for people who have lower income and less savings. Those are the people that program targets. And that's administered by the Department of Human Services in Pennsylvania. So who does Medicare cover? It covers people age 65 and older. And then it also covers people who have certain disabilities. People who have end-stage renal disease, kidney failure, kidney transplants. People who have ALS, which is Lou Gehrig's disease. And then also covers people who have been on Social Security disability. That's an insurance program that Medicare has. And if you've been on it for 24 months, then you qualify for Medicare as well. To be eligible in one of these categories, you have to be a U.S. citizen or have been a legal resident of the U.S. for 5 years. So today we're going to talk about these boxes. That's basically, most of our talk today will be about these boxes. And we call this the Medicare Roadmap. What it means is on the left side is some one set of plans that people who enter Medicare commonly choose to enroll in. On the right side is another set which falls under the category of Medicare Advantage plans. And so people usually choose one or the other. And we'll be explaining both. I'll be talking about the left side, and David will be talking about the right side. So on the left side, the first box you see is Original Medicare, and that refers to Medicare Part A and Medicare Part B. So those are the programs that are actually offered by the federal government. These other boxes are, all these other boxes are offered by private insurance companies, and they work within the Medicare structure. But Part A and Part B are actually administered by the Medicare program. And so what does Part A cover? Part A is called hospital insurance, and it covers the services you see here. So if you're staying overnight in a hospital in what's referred to as an inpatient stay, then that would be covered under Part A. Skilled nursing is referring to certain services in nursing homes that would be covered under Part A. Hospice is for people who are at a terminal stage in the last part of their life. And then blood administration for people who are in the hospital or in the inpatient setting. Part B is referred to as medical insurance, and that covers basically most of the services you would consider to be outpatient services. They're services that you'd be getting delivered to you while you're at home, or while you're not staying in a facility. And so it includes the physician services, includes home health services. Preventive care refers to things like vaccinations, things of that sort. Ambulance services, occupational physical therapy, all the different types of therapies, your lab tests, your x-rays, imaging, durable medical equipment. Basically, most services that are outpatient would be covered under that. Now, the exception is these services are not covered. So dental care is not covered, routine dental care. Now, if you have some kind of medical problem where you need dental care, let's say you have a tumor in your mouth or some kind of medical condition in your mouth, not just the filling that you needed, then that would be covered under the dental program, under the Medicare program. Also, if you needed an eye exam or corrective lenses, contacts, those sorts of things are not covered by Part A and Part B, what we're referring to here is original Medicare. But if you had the need for cataract surgery, that would be considered a medical condition, and so that would be covered by the Medicare program. Hearing aids, cosmetic surgery are not covered. Long-term care, so that's something that could be easily misconstrued. Although the Medicare will pay for certain stays in nursing homes, it's really for short-term stays where you're recovering from a condition. It's not for a convalescent stay where you're going to be there for a long period of time. That is not covered. Long-term stays are not covered by Medicare. And finally, Medicare is a program that covers services that are delivered in the U.S. If you go out of country, generally it's not going to be covered. So let me just stop here, see if there's any questions so far. Anyone have any questions or no? Okay. So, let's look at Part A and Part B, the original Medicare components. And each of those has deductibles and copays and premiums. And you'd be familiar with that presumably if you've had any type of health insurance in the past. So Part A premiums, for most people it's actually going to be zero. It's going to be a free coverage. And the only requirement there is that you have to have worked 40 quarters and contributed towards Social Security for 40 quarters during your lifetime. Also, if you don't meet that requirement, but your spouse has met that requirement, then that would qualify you for Part A coverage. So most people get free Part A. Under Part A, it has a deductible, which you can see here is $1,632 per benefit period. So what that refers to is when you get admitted to the hospital for the first time, the first $1,632 that Medicare would have paid if you didn't have a deductible, you were going to pay. And then after that, it'll cover amounts as shown here. So after that, for the first 60 days, you won't pay any additional amount. Then after that, days 61 to 90, it's showing you pay $408 a day. And then for the 91st to 150th day, $816 a day. Now, it says here deductible per benefit period, and what that means is a benefit period is considered a period within a calendar year where you have had hospital treatment. And then after that period ends when there's been a 90-day lapse from an inpatient stay to another inpatient stay. So if you were in the hospital for a number of days and then you had a lapse of only 30 days and then you went back in the hospital, you wouldn't have an additional deductible of that $1,632. But if a period of time elapsed from the time you were discharged from the hospital, more than 90 days, then all of a sudden you'd have to pay another $1,632 for Part A. Now Part B is a lot simpler. Basically,
A question?
yes.
On the Part A, within that example you described,
Yes.
does it need to be for the same medical condition within that benefit period? Or if someone was hospitalized 30 days later for a different condition,
No.
would the deductible
It doesn't have
already
to be the same condition.
Okay, thank you.
Folks on Zoom, please type your questions into the chat during the presentation. Thank you, and I will relay them.
Okay, so for Part B, there is a monthly premium, and everyone has to pay for Part B. And so for most people, it's $174.70 a month for that benefit. And then on top of that, there's a $240 a year deductible. So during the year, if you, let's say, see the doctor or get some x-rays and lab tests and stuff, so forth, the first $240 you're going to pay. After that, then what happens is Medicare will pay 80% of the cost of the amount that goes to the provider, whether it's a doctor, a lab, a therapist, whatever, and you pay 20% of that amount. Now, one thing to talk about is on the $174.70 a month, that's the standard premium for Part B coverage. But for people who have higher incomes, they actually have adjusted the premium so that you pay more, you pay an additional amount. And so, for people who file their income taxes as a single return, if you had $103,000 in reportable gross income, then you would, if you had more than that, then you'd have to pay an additional amount, more than $174.70 a month. And if you filed jointly, if it was more than $206,000 in an annual income tax filing, then you'd be paying an additional amount higher than $174.70.
How much is that?
How much is it? How much more would you pay?
Over 100,000. How much are you paying?
Well, it's got, let's see, 1, 2, 3, 4.
Just a
5.
guesstimate.
There's 5 different categories depending on how much higher you are. And I've got a chart for anyone who needs. I just have one chart. But I can afterwards, if you want to see how much it would be for the different levels of income.
Fine, thank you.
I can show you.
We can talk about that during the break.
It gets as high as $675 a month for
Okay.
people who over about $400,000 in income a year. Now, the Medicare program looks at is your income that you reported 2 years prior. So if you're just in, let's say you're going to start Medicare this year's 2024, it's going to look 2 years prior, it's going to look at your 2022 tax return. Okay, and that's what it's going to go by. One thing that these slides don't show is the fact that if you can make a case to the Medicare program that although 2 years ago I made this amount, but this year it's going to be a lot less because of certain circumstances, what they call life-changing events, then you can see if they would reduce that adjustment to the premium. And so events could be like you retired, it could be your spouse died, you're divorced. There's a list of life-changing events that could be used to say, I'm going to be making less this year than I did 2 years ago, and therefore don't charge me as much for my Part B premium. Yes?
That $174.70 a month, that's what you pay monthly, is that set when you apply and stays that way forever? Or, I mean, do you have to go back and ask them for adjustments, or does Medicare, every time you file your income tax, look at that and then adjust your monthly?
Okay. What the premiums are set by calendar year, so for each calendar year it's set, and then next year, from 2025, the Part B premium is going to be based on your 2023 tax return.
Okay.
Okay? That's how they'll look at it. So, and as you might expect, the Part B premiums go up every year. Yeah. Okay. So that's original Medicare. Are there any other questions about original Medicare?
Yes, is Medicare widely accepted among doctors and hospitals?
Good question.
Oh, good, yeah.
So Medicare is accepted by almost all doctors and facilities and providers of health services. There's just it's a very small minority that do not accept it. So if you have original Medicare, you'll be able to see pretty much anyone in the country who's providing medical services.
Okay.
When David talks about Medicare Advantage plans, that's not going to be the case.
That's
gonna
going to
different.
be, okay,
Yeah.
in network.
Yes. Explain that. Okay, so let's talk about Medigap. This second box here that's got the dashed lines around it, it's called Medigap, or the technical or formal term is Medicare Supplement plans. So a Medicare Supplement is a plan that helps to pay for some of these deductibles and coinsurance that we just talked about that original Medicare has. And so there's several of these plans that are available that you can purchase. You have to purchase them from a private insurance company. It's not offered by the government. The government reviews the different companies that want to be offered and has to approve them, but it is, these coverages are provided by private insurance companies. Now, as this slide shows, it says plans A through N. The different plans that are offered are standardized, have standardized benefit packages. And so, and each standard package has a letter, A, B, C, there's a G, there's an N, so forth. So, one of the things that when you shop for these plans, it makes it a little bit easier to compare plans, because if you know what level of coverage you want, then you can compare all of those plans offered by different companies that have the same letter. So, this is pointing out the fact that there's some employers who are offering plans like these Medigap or Medicare supplement plans through the employer. So they offer it to retirees. Does anyone here, does anyone think they have that situation where your company or your agency that you work for has a plan for retirees that works with Medicare? You do. Who do you work for?
Johnson & Johnson.
Johnson & Johnson, okay, yeah, some of the medical companies and the drug companies, state agencies, the federal employees, the state people who work in the school districts have these kind of programs. So, and if you have that kind of situation, then you may have an option to enroll in addition to Part A and Part B, one of these plans to help to pay for your co-pays, your deductibles, and so forth. And frequently, those are good deals because the fact that the company or agency that you work for is going to help to pay for some of the cost of that plan. My wife is a veteran, Army veteran. She was an Army nurse, and she qualifies for military pension. So she has a program called TRICARE for Life, and so that basically is like a Medigap plan, and what we're going to talk about later, a drug plan is a combo of Medicare supplement and drug plan, and so that's a great deal because that's free for people who are in military pension. Now, for other people, if you're a veteran, you may qualify for veterans' medical benefits in the VA system, but if you do, you can choose to either go through the VA and have the VA pay for those services, or if you go outside, you can choose Medicare, but we'll never have a situation where Medicare and the VA will pay for your services. It will be either one or the other. Okay, so I think the main point here to note is that the Medicare supplement policy is paying for deductibles and coinsurance in original Medicare. Original Medicare doesn't cover outpatient drugs, and so the Medicare supplement won't cover anything related to outpatient drugs because that's not part of original Medicare. So what you'd have to do is you'd have to purchase separately a prescription drug plan, and that's what we'll be talking about next. As I said, the Medigap policies or Medicare supplements are sold by private insurance companies. These are the current plans that you can choose by letters, A, B, so on. And then for people, I don't know if there's anyone here who turned 65 before January 1st, 2020, but if there is, there's also two other plans that you can choose from. They're called plans C and F. And those, if you had an F plan, that would pay for everything. You would pay nothing out of pocket. They cover all your deductibles co-insurance. And C would do the same. And so the government decided they wanted people to have basically some skin in the game, so they said, well, going forward, we want everyone to at least have some kind of deductible. And so the most generous plan you can get of a Medigap policy is a plan that covers everything, that all your out-of-pocket expenses for medical services, except for your Part B deductible, which is $240 this year.
Excuse me,
Yes.
why did these people get in 2020 this freebie?
It's not a freebie. I mean, they had to pay for something for the higher coverage. But as I said, the reason the government decided they wanted to stop having people pay nothing for their health care is they felt that encouraged people to overuse care. And so they wanted people to pay at least something.
Those two plans, C and F, you still had to pay the Part B premium,
Okay.
okay? What it did was it eliminated the Part B deductible that Harry had up, I think it was $235.
Yes.
Okay, I'm getting old, I can't
Okay.
remember the numbers.
I have a question about the Medicare. None of them pay the premium though. You always have to pay the premium, none
For
of
Part B.
Medicare. Yeah.
Part B, everyone pays.
Okay, none of these Medicaps cover that.
Okay, so one thing is, it's crazy to me when I see how much the premiums can vary for any level of coverage. So you pick a G plan, an N plan, or whatever plan, and you look at all the companies, there could be like 15 different companies offering plans of that type. And the premiums for any particular individual, and the premiums are set based on your age, your gender, and whether you smoke or not, and then where you live, your county you live in. But there's a huge disparity in premiums across the different levels. And you'd think, since it's standard benefit, you'd think everyone would be pretty close on premiums, but it's not the case. So you really need to shop. And really, it's difficult for you to shop by yourself because there's no good spot where you can go and find out all the premiums that are offered for any particular plan. And so that's where, coming to one of our PA-MEDI counselors, we have access to a website that shows all those premiums, so we can do that comparison with you. Or if you go to a Medicare broker, then they have that access to that information as well.
So it wouldn't matter if you paid 40 or 200, you still get the same coverage?
Well, no, this is referring to lots of different levels. The $40 is for real bare bones, a much lower
So-
level.
Okay.
But so that range refers to all the different levels of coverage that you can buy. Okay. And actually, it can go over 200 even.
The $40 ones are very high deductible
Yeah.
plans. Okay, typically you're gonna be looking at somewhere between $100 and $200.
Do they take into account pre-existing conditions?
I'm sorry, Kate,
Do they take into account pre-existing conditions?
no, they cannot take account pre-existing conditions.
Wow.
What?
No, it's pretty good.
If you buy within a certain enrollment period,
Oh,
okay? If you get outside that enrollment period, yes, you're gonna pay.
and what's that enrollment period? 3 months before, 3
We're
months
gonna cover
after?
that.
We'll talk about that. So I'll just repeat that question in case the people online couldn't hear. Question was, is there any pre-existing condition, do pre-existing conditions factor into how much you pay for your coverage? So if you first enroll when you're first eligible for Medicare, and David will be talking about the enrollment periods, but if you do it when you're first eligible, then the Medigap plans cannot take into account your pre-existing conditions. It's the same premium for everybody. Later on, if you decide you want to get into one of these plans, they're going to review your medical status. They'll ask for your health history. They may even contact your doctor to find out what conditions you have. And then they'll decide whether they want to even accept you for their health plan. And if they do, they can even charge you a higher premium because of the conditions that you have. So for these types of plans, the best thing to do is to enroll them when you're first eligible. And then you don't have to worry about your medical conditions, because today you might be healthy and tomorrow you might find out you have cancer, or tomorrow you might be in a car accident, a serious car accident. So it's risky if you don't choose to enroll early on. The rates for these plans will change annually. They change by age, and then they change with inflation. Here it says good for travelers, and what that means is if you have a Medigap plan, then you can see any doctor in the country, any provider in the country, and these plans will cover the amounts that they have in their benefits. Okay, next, prescription drug benefits. So again, to make this clear, original Medicare Part A and Part B covers medical services, does not cover outpatient drugs. There's one exception, I'll explain. So, and then the Medigap is going to just help pay for the things that Medicare A and B does not pay for, but only for those services. Neither of those two boxes pays for prescription drugs, outpatient prescription drugs. So therefore, if you're going with this combination of original Medicare and Medigap, you want to get a prescription drug coverage. And it's especially important these days because of how expensive some of these new drugs have become. And we, as counselors, we run into people who have not had drug coverage. They've had Medicare for 10 years or so. They said, well, I'm healthy. What do I need to buy drug coverage for? Well, as David will talk about later, if you wait and don't enroll in these things when you're first eligible, then you pay penalties for enrolling late. And so they don't want people to wait till they really need some expensive drugs and then sign up for a plan.
Does it vary, prescription drug benefit, does it vary how much it covers, or is it 80% or 100%?
Yeah, okay, so that. So these drug plans are also offered by private insurance companies, and they have premiums, they have deductibles, they have co-pays. So some have zero deductibles. And then, they'll pay for cheap generics. They may pay everything. You might not pay anything out of pocket. And then for more expensive drugs, it gets more and more expensive for you as well. All these plans are also screened by the Medicare programs, CMS, or Centers for Medicare and Medicaid Services. So they have to be approved by them. But there's a huge variation across them in terms of premiums, their deductibles, how much you pay for specific drugs, what drugs they cover, which we call the formulary. So there's a lot of things that you have to review to figure out which is your best option if you want a drug plan. Now this refers to also may be included in your Medicare Advantage plan. When David talks about the plans that fall into that category, they have drug coverage as well.
Harry, we have a question from somebody on Zoom. To clarify, if a person is eligible for Medicare but does not enroll at 65 but waits until they are 67, stays with employer plan in that time, do pre-existing conditions get reviewed and penalties apply?
I'm going to cover that.
Yeah, David's going to talk about that.
Answer forthcoming. Okay.
Okay, so how do drug plans work? Everything about Medicare is complicated now. I tell people, Medicare is too complicated because Medicare for Dummies, the Medicare for Dummies book is over 300 pages long. So that's the way we have to get trained and certified for this type of thing. So the prepaid drug plans, PDPs, some have a deductible, some do not, but the maximum deductible they're allowed to charge right now is $545 a year. So each year the deductible starts all over again. And then you pay co-pays depending on the drug. As I said, cheap generics, you might pay $0. Expensive ones, you might pay 25% of the cost of the drug or something of that sort. So first you have the deductible, then you have what is referred to as initial coverage, what the plan covers initially. And then once the amount that you have paid and the insurance company have paid reaches $5,030, which for some of these drugs you can hit pretty quickly, unfortunately, then you will pay 25% of the cost of the drug up until the total out-of-pocket cost for you reaches around $3,300. After that, then it goes to $0. Next year, the max that you'll pay in this donut hole, the coverage gap column, is $2,000. So after you've paid out of pocket $2,000 for your drugs, then the drug plan will cover the rest. Now, the key thing is also it has to be in their formula. It has to be a drug that they cover. So that's one of the things that we can work with you to show you how to use. There's a very good tool on the Medicare website where you can find out what drugs are covered and how much they would cost. But yeah, next year the maximum amount you pay out of pocket for covered drugs would be $2,000.
Just to clarify that, Harry, that $2,000 is the premium plus what you pay at the drugstore for the entire year for all four phases up there. Okay? Do I understand that correct, Harry?
I didn't think it included the premium.
I think it
Does it?
includes your total drug costs.
All right. Okay.
So, there's gonna be some interesting things happening in the drug space next year.
Yeah. We're wondering what's going to happen to drug plan premiums because they're kind of capped at $2,000. Okay, so that's the end of my presentation. We're covering all these three categories. Is there any more questions about the left side of this chart?
I just had one back here.
Yeah.
It was just on the money. Does the sale of a house go as an income for a year?
Well, whatever shows up on your income tax return. So I guess if you sell a house and make a profit on it, that shows up in your income tax return, doesn't it?
Well, if you're over a certain age, it doesn't. You can do it one time or it doesn't. You don't have to pay taxes on it.
I mean, whatever is considered your gross income, that's what they look at on the tax return.
I think it's line 12 or something, not, I could be incorrect by that line.
What was that? I didn't hear you.
I think it's line 12
The
or
line
1040. But,
Yeah, because you get a one-time exemption when you sell a house.
whatever that income is on line 12 is
Yeah.
what you.
Okay.
Wow, okay.
All right. Okay, any other questions? Well, Dave, it's all yours. Oh, actually, before Dave, I wanted to just ask
I'm sorry.
that people stay, we have a questionnaire which we've been asked to ask people to fill out about this course. So if you can stay at the end of the class, we'd appreciate it. And also, there's some forms that I have that weren't in your packet, but for certain situations, I guess, things that'll come up with, that Dave will talk about. We have some additional information for people in those circumstances. Okay.
All right, what we're going to talk about are Medicare Advantage plans now. I'm sure if you're 65 or close to it, you've gotten a lot of things in the mail.
Sure.
Most of them have to do with Medicare Advantage plans. And Medicare Advantage plans basically are the privatization of Medicare. All right? And what Harry talked about was original Medicare, which is a law passed in 1965, signed by Lyndon Johnson. It's a single-payer system. Okay, Medicare Advantage plans were put into effect basically to try to reduce the cost of Medicare. And in many cases, it hasn't done that. So Um, But you still have to have Part A and B. Part A, if you paid your FICA tax, as Harry said, it's premium free. Part B, you're still gonna have to pay the Part B premium. Okay? So you don't get out of that either which way. A lot of people come to me and they say, well, I have a supplement. So I said, what is your supplement? They show me a Keystone 65 card. No, you have a Medicare Advantage plan. All right? It's private insurance, it's approved by Medicare. But all the rules that Harry just talked about in terms of what you're gonna pay as a hospital deductible and things like that go out the window here. All right? There are monthly premiums. In many cases, those premiums are zero. I think there's like 10 or 12 companies that offer Medicare Advantage plans in Chester County. All right? And some of those companies offer, like, I believe Aetna offers 8 plans. I believe Keystone, which is Blue Cross Blue Shield, offers 5 HMOs, 2 PPOs, and I don't know. So what you have is, HPMC, UPMC offers 2 plans. So you have to kind of navigate the waters a little bit. Many of those plans have 0 premium. In other words, you're not paying anything per month. Okay? People will say, oh, I'm paying a premium for a supplement, I don't want to pay it. Well, you can look at a Medicare Advantage plan. The disadvantages, of course, are there are co-pays. It's basically pay as you go. Most of the plans are HMOs. Many of them are some of them are PPOs. Some of them mistakenly make the decision to go with a PPO thinking that they can see any doctor. Well, the doctor must accept the company's assignment or what they're going to pay. Some doctors won't do that. So let me see if I can work this thing. Ah, I did. No, I went the wrong way. Okay, so Medicare Advantage plan, privatization. It's another way of getting your Medicare benefits. You're still part of the Medicare program. Okay, every year the insurance companies submit to CMS, the Center for Medicare and Medicaid Services, what their plan. The plan is either accepted or they tell them to modify it, okay, and they come back, okay? Provider networks vary by plan. You know, when UPMC entered this market a couple of years ago, they didn't have a very big network. In Pittsburgh, they had a huge network, all right? A lot of people that come in during open enrollment want to change their plans because their doctor may have moved to a different plan. And they usually have prescription drug coverage. In other words, they call MAPD, Medicare Advantage Prescription Drug Plans. Do all of them have prescription drug components? No. Many people get veterans, medication to their veterans, okay? So they don't need the prescription drug plan or don't want it. Okay? So as I said, health maintenance organizations, preferred providers, and their special needs plans. Typically, those are for dual eligibles, people that are both on Medicare and Medicaid. Okay? And the plan has to cover a lot of the same benefits in the original Medicare. In other words, there's a criteria list that the Medicare Advantage providers submit and have to be approved by CMS. Okay. What you hear a lot on TV, okay? Joe Namath is my favorite. Get all the benefits you deserve. Dental, hearing, vision, transportation, meals, over-the-counter benefits. Those are real benefits, okay? You kind of have to dig into it a little bit. You have to go to a dentist, for example, that's in network, okay? Vision may include an eye exam and 1 pair of glasses every 2 years. So you have to find out what really is covered. For the medical part, there is a maximum out of pocket. And I think that number is around $7,500 a year for HMOs. I forget the exact number. And for PPOs out of network, it's about $10,000 a year. Okay? Medicare Advantage plans have come under scrutiny in the last year particularly. Okay? There's a number of things they've come under scrutiny for. Overbilling, authorizations. That doesn't necessarily mean they're bad plans, it's just that Wall Street is kind of getting under case about it a little bit now. So if you look at a comparison between a Medigap and a Medicare Advantage plan, this is kind of a little bit of a report card. Okay? Medicare Advantage plans do not look at pre-existing conditions. You can change your plan every year during open enrollment. Open enrollment every year is from October 15th to December 7th. So you can, every year you can look at your Medicare Advantage plan, but you have to do it with a jaundiced eye. In other words, are my doctors in this network? The hospital I want to go to in the network? Some people like to say that they want the University of Pennsylvania Hospital in the network, just in case. Okay? Some people say that they want PA-MEDI Hospital in the network because it's the trauma center for Chester County. All right? So, if you know, that doesn't mean you won't be taken there, and you'll be covered, because no matter where you are in the country, if you get into an accident, you're covered, whether that's in network or not. Emergency services are always covered with the Medicare Advantage plan. But the follow-up coverage, or the follow-up care, would come from your own doctor network. So in other words, you might get taken to PA-MEDI Hospital after a car crash, but after you're released from there, then you have to go back into your network. Okay? You might get extra benefits. For example, I think AARP, United Healthcare, if I'm correct, offers silver sneakers. You'd be surprised how many people, my accountant, his father, who I met, is a great guy. He decided to go with a Medicare Advantage plan for silver sneakers.
Just because.
You know, his son would say, I'll pay for it. And no, no, okay? But the plans can change yearly. During that open enrollment period, we see a lot of people come in. Mostly it has to do with the prescription drug plans. But if you want to change your Medicare Advantage plan, okay, we have to kind of look and make sure all your doctors are in network. The other thing you have to be careful of a Medicare Advantage plan, and a lot of people don't look at this. I recently did somebody, and they had a plan that had a $1,000 medical deductible, zero premium, but the first $1,000 were out of his pocket for medical treatments, and he didn't realize that. The salesman didn't tell him that.
David, question from Zoom. Is there a maximum out-of-pocket for original Medicare plans?
No, there's not. Original Medicare either covers it or it doesn't, okay? I will tell you from personal experience, I'm a cancer survivor from last year. Did 45 radiation treatments. I was on oncology drugs and hormonal therapy drugs. Several urology visits, 2 surgeries, and my out-of-pocket was zero. So, now does that happen in every case? I've heard a case where people had hip replacements and they said they ended up paying $136 or something. Okay? So you can switch yearly. Referrals aren't what they used to be. Pretty much nobody asks for a referral anymore, but authorizations have become a tricky wicket with Medicare Advantage plans. And the current administration is trying to clear that up. Okay? Somebody asked a question about Medicare supplements. Boutique doctors do not take them. Okay? When you talk about maximum out of pocket, pediatricians generally don't take them. Okay? So how and when to enroll? This, you got something to say, Henry?
Well, I was going to say on the authorizations, in case you don't know what he's referring to, it refers to prior authorizations, and Medicare Advantage plans are, frequently will say that before you can get a service approved, well, before you can get a service, you need to get it approved. And so some of the plans have a reputation for being
A little slow.
unreasonable about giving approvals. And so in original Medicare, generally, there's no prior authorization required. If your doctor says you need it, you can get it, and it'll be paid for. But with,
Speaking from my own experience, you get to meet the other guys when you're waiting to go in for radiology. And I can immediately tell somebody if they want a Medicare Advantage plan or a supplement. Those of us on supplements got 45 radiation treatments. Those in Medicare Advantage plans got 28,
Wow.
okay?
But you paid for it up front.
No, it was part of my
Your premium.
Medicare supplement. I mean, I don't know how they paid for it, okay? I don't know what was covered, okay? I find that was what was authorized. An authorization, 28 services. So I asked the oncology radiologist, I said, well, how do you come up with that number? He said, no, the insurance companies do. I said, well, what do you do then? Well, we increase the dosage.
So they just get around it,
Yeah, they said,
Just a
well,
shorter
you're gonna get the
time
same number of megacuries or whatever they are, but,
just shorter period.
yeah, you're just gonna get it over a shorter period. So, but thanks for clarifying that, Harry. This is a big favor. How many people here are still working or coming up to Medicare age? Get an idea, mostly everyone here. And people wonder, what's gonna happen? Do I keep working and everything else like that? And the other question that always comes up is, well, I'm 65 and my wife is 62. Well, what happens when I go off my work benefits? Well, let's talk about a few things here. Okay? If you're collecting Social Security, let's say you went on Social Security at 62. When you are 65, you automatically be enrolled in Medicare Part A and B. Okay? That's a critical thing. Okay? Because if you're still working and you got Part A premium free, well, fine, you keep the Part A. Sign, check the box off on the card, say, I don't want Part B. Send it back. Okay? Because you can have Part A and still be working and not paying anything. All right? But we're going to talk about it a little bit. Why do you send that card back? Okay? Okay? When you're turning 65 and not collecting Social Security, you can sign up. You can call them, you can enroll online. How many people here have a SSA.gov account? Okay, that's a good thing to have. If you don't have one, open one up. Okay, because that's the easiest way to enroll in Medicare. Okay? I want to enroll in Medicare, okay? When you turn 65 and you want to enroll in Medicare, you get an initial enrollment period. That enrollment period is 3 months before your 65th birthday, the month of, and 3 months after your 65th birthday. Okay? Coverage, if you enroll before the first 3 months, will start on the first day of the month of your 65th birthday. Let's say you're born on July 4th or July 14th or whatever. If you apply, your coverage will start on July 1st. Okay? So, you cannot apply for a supplement, okay, or a Medicare Advantage plan unless you have that Medicare card. Why have a supplement? It's supplemental what? You don't have it. Okay? The other thing that happens is that you can defer Medicare if you're still working for as long as you're working. I have a friend of mine who's 82, he's still working. Okay? The only criteria there is if you work for a company with 20 or few employees, okay, then you must take Medicare at 65. okay? So you get some people that work for a dental office where there's only 4 employees. You're gonna take it at 65. Okay? As I mentioned, you can still take Part A. It'll act as secondary to your primary, and most of the time, you won't use it, okay? Just maybe some tweak it'll pay for something. Okay? You don't want to sign up for Medicare. If anybody here in an HSA, health savings account,
Yeah.
okay? Are you still, if you're still working past 65,
Yeah, he won't, no, he won't.
okay? If you're still working past 65, you cannot contribute to an HSA
Right.
B in Part A. Okay?
You can use it, you just can't contribute to it, correct?
You can use the money,
Yeah.
but you can't contribute to
Yeah,
it.
don't lose it.
Well, the thing is, you can get penalized pretty severely if you stay in that HSA. The government does a 6-month look back, but it doesn't look back prior to your 65th birthday. So let's say you're 70 years old and still contributing, they'll do a 6-month look back, see what you've contributed. And if I'm correct, you're gonna pay a penalty, and there's an excise tax. I mean,
Okay.
it's pretty, I looked at it one time and thought to myself, stay away from that. Okay?
We'll use it up.
What? A question back here.
I was just wondering, when you apply for this, how long does the application take?
For Medicare Part A and B,
Yeah,
I've had people get their card within a week,
a week?
and I've had people, one of my neighbors who I'm helping right now, she applied for it April 14th, and she still hasn't gotten it. Okay?
Okay.
Now mine, I sent it to
Well, you
the
know, and it's
automatic.
ridiculous, I mean, I'll tell you, this is anecdotal, but she finally went to the Social Security office and said, why don't I have my card?
Yeah.
Okay? And they said, we need a copy of your marriage
Yeah,
certificate.
but they didn't ask for it, right.
They didn't ask for it. So I was talking to our regional coordinator yesterday, and I said, have you ever heard of this? No.
Well,
So just stay on top of it.
Okay, yeah.
And that's why you should have an SSA.gov account and a Medicare.gov
Yeah.
account, because you can track these things. Okay? Is anybody here on Obamacare or the Affordable Care Act? Because when you transition into Medicare, you cannot be on the Affordable Care Act. Okay? People that are not eligible for Premium Part A can stay on it, but you lose all your subsidies. Okay, so how do you enroll in a Medicare supplement? I want to talk a little bit about, I didn't see it come up yet. The slides are kind of like new to me because they shuffle the deck. This is one of the most important things I'm going to say all night. The effective date of Part B triggers an event. And you have so many months after that to get a supplement without looking at pre-existing conditions. That's 6-month period. If you let that 6 months lapse, okay? A friend of mine, and every year somebody comes in this way. Well, they mailed me, I was collecting Social Security, but I was still working, and they sent me the card, and I just kept it. I figured, I'll get more coverage with Part B, I'm paying the premium. But I went to get a supplement, and they said no. The 6 months had elapsed. They don't care if you're employed, have dual insurances, or anything. The minute you get that Part B, effective date, okay, that triggers a clock. Okay, and if you don't do anything in that clock, you wait a couple of years, you quit work, you retire, you're going past that time. Okay, then you're subject to medical underwriting where they will look at pre-existing conditions. Okay? So, you want to enroll in a supplement. I'd almost like to say, we have access to the insurance tools portal. Actually, I talked to a broker friend of mine, and he does not even have the same information we have. We must have a higher level. And one thing that I try to talk to people about, price, price, price. It's like real estate, location, location, location. You have to look at enrolling in this as, I kind of tend to look at how many people they have enrolled in a plan. If you look at something and they have 74 people statewide enrolled in a plan, the risk pool is too small. The chance of a rate increase increases. Okay? I tend to look at the loss ratio, which means how much money are they paying out in claims for how much money they're taking in. If that number is high, that means you're going to see price increases, generally speaking. Okay? You can enroll by calling the insurance company directly. And I think our list of insurance companies in Chester County here is like 65 or something. I think I counted them up one time. So a lot of people will call a company. Remember, that agent has one job, to sell you a plan before you get off the phone. Okay? That's all he cares about. And once you buy that plan, then he wants to sell you a drug plan, which may not be the right drug plan for you. Okay?
Can you go different places?
Or you can go everywhere you want to.
No, for one plan, I can Part B be with another.
Well, you can go, you can get a supplement from one company and
Right.
a drug plan from another company, which most people do,
Okay.
okay? But a supplement you gotta be very careful about, because it's like a marriage. You know, you can get a divorce, but it's called medical underwriting. I've changed twice. Cancer survivor this year, I can't change again. Okay? So if you want to go through a licensed broker, I generally say there's 3 different criteria you look at. First of all, you want to find somebody who's younger than you. You want this guy to be around as you get older, in case there's an issue. Okay? Second thing, you want to find somebody who represents at least 12, 15, or 18 plans. Okay? Because if you go to a guy that represents 3 plans, you're going to get one of 2 choices. The cheapest plan he's got or the one he makes the most money on. The third criteria is you want to find somebody who's going to be around a long time, who specializes in Medicare. Okay?
Question from chat, how is the effective date of Part B calculated?
It's when you apply for it. In other words, if you get that if you're on Social Security and you get that card on right before your 65th birthday, then you're on Part B. You have to send it back. Otherwise, you have to apply for Part B. Okay, which you can do on ssa.gov. Okay, there's several different portals into it. Okay, hope I answered your question. Okay, when can you buy a Medigap? As I said, within 6 months of enrolling in Part B. Okay? You may be subject to medical underwriting. If you lose certain kinds of health insurance, okay? In other words, you retire, you get a special enrollment period. And once again, you can pick a Medigap or a Medicare Advantage plan. Right? Any further questions on Part A or B enrollment, or when you can buy a Medigap?
If you buy a Medigap plan, each year, do you automatically stay in that plan?
Yes.
Or you pick another one? Or?
It's like a marriage, as they say. You're in it for life.
Okay.
Okay? And every year, your premium on that Medigap plan is going to go up. Okay?
I have a question.
Sure.
So, you know, I met with you privately and I told you I'm getting laid off in the end of June.
I remember you, yes.
So I have some retirement health care, but I also have severance health care. And my advisor from work said that I have to take the severance health care for 1 year before I can join, before I switch to the retirement health care. But now you said I only have 6 months,
Okay, if that severance health care is creditable coverage,
right?
then you'll get a special enrollment period at the end of that year. The
Okay.
question you have to ask is it creditable coverage?
Okay,
Okay? Because that's the way they look at things. We've had people come in and they said, well, my benefits were carried for a year. Okay? And they said it was COBRA. COBRA is not considered to be creditable coverage.
this wouldn't be.
Really?
Really.
Yeah, this wouldn't be COBRA, but they said if I do not take this, then I would lose my, if I don't take the severance healthcare, I would lose my severance pay.
That's a tricky one because I would make sure it's creditable coverage. I would
Okay.
make sure you're healthy. You're surprised by that.
Oh, yeah, surprise, yes. Cobra's,
Not considered creditable coverage.
really?
So at the end of Cobra, you must enroll
No,
Something.
you
in
can't.
something else or Medicare.
Yeah, Medicare doesn't care about COBRA. If you run it for a year, tough.
Really?
Yeah, you'll pay a penalty if you.
They're trying to get that taken care of, by the way. Okay? They're trying to get that taken care of. Okay? So, when do you want to enroll in a Medicare Advantage plan? Okay? Obviously, you need your Medicare Part A and B. Okay? And that's over, you get an enrollment period. Most people don't wait. Most people already have their plan picked out, so it's gonna, if your birthday is July 14th, your Medicare coverage starts July 1st, and you're gonna have your Medicare Advantage plan or your Medigap start July 1st with it. Most people don't wait that 6 months. All right? Okay? One case might be, if you have that severance, you might wait. But I would check to make sure it's creditable coverage. That's what it just says normally don't coincide with the effective date. Brokers also sell Medicare Advantage plans. Brokers make a lot more money selling Medicare Advantage plans than they make selling Medicare supplements. So if they're trying to push a Medicare Advantage plan on you, just be a little weird. Let me go back here for a second. So with Medicare Advantage plans, you have to check, are your doctors in network? The dentist you want to use, if you got dental coverage, is that in network? Okay. Are all your drugs in that plan's formulary? Okay. And we can assist you with that. We don't make, if you're interested in either enrolling in a drug plan, Advantage plan, or looking at it every year to make sure you're in the best plan for you. We do a lot of counseling during open enrollment, October 15th to December 7th. Is anyone here a teacher? Okay, 'cause I just was gonna mention that the HOP open enrollment, because teachers' benefits are different time frame. Okay. What if you're still working? This is a tricky question. Active employment. Okay? So after, enroll to 8 months after group coverage or active employment ends. Okay? So, you have to submit 2 forms. You're still working, this is the case, you're still working, you're 68, 69, whatever year you retire. Okay? You then have to apply for Medicare Part B. You're not in your initial enrollment period anymore. When you were 65, you have a special enrollment period. Okay? So, you have to fill out CMS 40B, which is your application for Medicare Part B. But the government doesn't know that you have been working. Okay? So they want proof. So somebody in your company has to fill out Form CMS L564. Now, both of these forms have 3 pages of instructions and 5 lines that you have to fill out. Okay? You have to submit the forms together. Okay? And it has generally been the rule that you have to take them to the Social Security office yourself. Okay? Get a receipt. Understand something, the way Social Security works and Medicare, if it's not in the computer, it doesn't exist. Okay? Okay? So, what if you're still working? You can apply for Advantage plans 63 days. This is different than a supplement. Remember I said a supplement, you get 6 months? Medicare Advantage plans, you get 63 days. And Part B, or Part D drugs is 63 days as well. Now, some people who work for some pharmaceutical companies get drug coverage for life. If it's creditable coverage, that's fine. Okay? If you decide to work through an insurance broker and he doesn't want to sell you a Part D plan or you need one, be a little wary. The cheapest plan on the market out there right now, I forget, WellCare Value Script or something, is 50 cents a month. How much commission do you think that broker is making? General enrollment period. What happens if you miss your dates? And there's a general enrollment period for Part B, okay, which is January, February, and March of every year. Coverage will start the month after you apply. So if you apply in January, it'll start February 1st. If you've had a 12-month period where you have not had coverage, there's a penalty. It's 10% of the going premium, or the going monthly premium for the rest of your life. Okay? So that's a late enrollment penalty. There's also Part D late enrollment penalty. Part D enrollment period is October 15th, just like the Medicare Advantage, to December 7th. Coverage starts January 1st. That's a lot less. That's like $4 a year. Okay? So late enrollment penalty is parts of A, B, and or D. So it's an addition, and pay penalty is about, since the going rate right now is $174, it would be $17.40 a month. Roughly $4 a month for the rest of your life on the drug plan. I've had so many people come in and they say, oh, I get a drug plan. I said, well, what do you have now? I've never had one. Well, when did you start with Medicare? 12 years ago. Start sticking it up. Okay? When can you switch plans? Medicare Advantage plan or Part D during open enrollment. October 15th to December 7th. Coverage begins January 1st. Most people look at their drug plan every year. You know, after a year or two of helping a lot of people, they just do it themselves. They learn how to use the plan finder and you can go in. But one nice thing about Medicare with the plan finder the way it is, if you're getting a drug for a chronic condition or any condition actually, it automatically loads it into the plan finder. Okay? So you don't have to enter your drugs. What you may have to do is delete a few. Let's say you had Lyme disease, and you're off the doxycycline, well, you're gonna get that off there next year. Okay? Coverage starts January 1st. There's one other thing I don't think they mentioned in here about Medicare Advantage plans. If you have a Medicare Advantage plan, have a Medicare Advantage plan, nothing else, okay? Doesn't apply to supplements or anything. You can change it one time during the first quarter of the following year. So there's from January to March, you can change it one time. Okay. Okay. That's the one time. These slides are a little bit out of what I'm used to, so. Okay, other special enrollment periods. I had a woman in a few years ago, she was on Remicade. And she was requiring 2 infusions a month. Each infusion was $7,200. Okay? And I have a little bit of a story to tell you. That was $14,400 a month. Okay? I don't know of a single Medicare Advantage plan, because that's a Part B drug. It's not, you're not picking it up at the drugstore. It's a Part B drug. It's administered at a medical facility, a doctor's office, or wherever. Okay? There is no Medicare Advantage plan that I know that pays for that. And if it would be a supplement, it would be paid for with original Medicare. So her cost on that was 20% of that $14,000 a month, which is roughly $3,000 a month.
Still a lot.
It just so happens that her income was roughly $3,000 a month.
Question related to that from chat. Are Part D plan offerings the same for original Medicare and Advantage plans?
No. Aetna might offer I'll pick a company. Aetna might offer a Medicare drug plan that is a totally different formulary than a Advantage plan. So it's not the same it's not the same formulary or cost structure. Okay, but they do have to adhere to the CMS deductible requirement. Was it $535 a year? So this woman, her mother lives in Texas, and her Medicare Advantage plan was not offered in Texas. So she moved to Texas to drop her, to be able to enroll into a supplement, and 6 months later moved back to Pennsylvania.
Because it dropped Medicare.
No, because she was paying $3,000 a month for these Remicade infusions in Pennsylvania, but the only way she could get was a special enrollment
I'm
period
looking at
outside the existing service area. Okay? There's also a thing about you can change at any time if for a Medicare Advantage plan or a supplement, or I'm sorry, Medicare Advantage plan or a drug plan, if there's a 5-star plan. There are currently no 5-star plans in Pennsylvania. Okay? They're rated 1 star to 5 stars. Okay? And 5 stars being the highest.
Which states offer them now.
Well, there were a few Medicare Advantage plans last year that were 5-star through Keystone 65, but they didn't retain it for some reason.
Must you buy Medicare within your state and county?
Yes. That's a problem also, you know, people do get caught. You know, they buy a house in Florida and they have their domicile here in Pennsylvania, but all of a sudden the Medicare plan realizes that they're
Really living in
billing
Florida.
from August to May in Florida, that they're really not living here anymore. So we do run into that once in a while. Okay? So, whoops, I'm sorry. Sometimes you drop your employer coverage. There is a general trend in a lot of companies, like Merck, I know I can talk about because I've done a few people there. Johnson Matthey is another one in the area. They offer people stipends, $2,000, $2,400 a year to each spouse, okay, for life, and it goes up every year, to pay for medical expenses. They don't care what you buy. You can buy a supplement, you can buy a Medicare Advantage plan, they don't really care. You can pay your Part B premium. But you have to stay within the realm of a captive broker, like Ave or One Exchange or those people. So you have to buy it through them. And they usually have both Medicare Advantage plans and supplements in there. You can look at them every year. Okay? But more and more, we're seeing that companies are dropping the Medicare supplements in those plans. You have to buy a Medicare Advantage if you want that stipend.
Question from chat, who rates the plan and what is the basis? For example, a 5.
Well, I have limited knowledge in that area. CMS rates them. And Harry may know more about this than I do.
Well, it's based on a combination of performance metrics where they, like for drug plans, they look at how often how long it takes to fill orders or make approvals for drugs. It also incorporates consumer satisfaction surveys that CMS runs as well. So it's a combination of objective metrics and consumer satisfaction.
Okay, thanks, Harry. There are programs to help with costs. Generally speaking, these are for low-income people to get their Part B premium paid for. There are typically going to be both asset and income limits to these. Medicare Savings Program, that pays your Part B premium. You have to apply through the Department of Human Resources in Thorndale. The County Assistance Office is called. You apply online to Compass. There's Extra Help, which is, believe it or not, is a Social Security administered program that helps with drug costs. There's PACE and PACE-NET. Okay? For example, a 40-year-old on disability who's now on Medicare can apply for LIS, cannot apply for PACE. You have to be 65. Okay, there's income limits for PACE, but not asset limits. So if you're looking at, I think the number now is up to like $43,000 a year, you can get some assistance with PACE-NET. So I think I've pretty much covered everything here. Any questions? Sure.
If you go on Medicare Advantage, can you switch over to Medicare Supplement, Medigap?
If you go through medical underwriting.
Okay. Do you have to get answers to those questions?
As I say, it's like a marriage. You can always go from Medicare Supplement to Advantage, but getting back is harder. Okay?
You can always add a different coverage to DC. All those, you can add them, but you're penalized.
No, A and B, you apply for it. If you apply for them in time, okay,
Right.
you don't pay a penalty. Okay? Except for what they call the IRMA surcharge, which you asked about, income-related monthly adjustment. Right? Then you apply for a supplement, which you keep for life. Okay? You apply both with a company and a plan, A through G. Okay? If you want to change either one, you have to go through medical underwriting. Now, do all companies do medical underwriting the same? No. I went through medical underwriting with a company, Transamerica, and it was difficult. They had They wanted to know if I cut my toenails every day. I then went with an Aetna company, and the medical underwriting was 5-minute phone conversation. I got off the phone, I go, what happened? You know, but it worked. So brokers do know which companies are more severe with the medical underwriting and which ones are not. That's something we don't have a good knowledge of as PA-MEDI counselors.
So if you decided initially to get AB and then add your medical, I can at some point say, I don't like who I'm using as an insurance and change them.
If you have A and B,
Right.
okay, that's government.
Right, and then I get medical as a private,
Then you get supplement,
right.
okay? You can't change it without going through medical underwriting.
But
If you-
that, can I change to a different, that's changing to a different insurer?
Yes.
Okay.
You go through medical underwriting, or you can switch to a Medicare Advantage plan during open enrollment. Oh, okay.
But then that's it.
No, on Medicare Advantage plans, you can change every year. Remember,
Okay,
you have original Medicare and a supplement.
right.
Okay? Okay, which is basically a law. I hit something wrong there. All right?
Mhm.
Supplements are the privatization of Medicare, so you can change those every year. There's no medical underwriting, I'm sorry, Advantage plans are, the privatization of Medicare, you can change them every year during open enrollment.
So I have a question.
Sure. I had 3 hands.
Oh, go ahead, go ahead. Okay, so Medigap is considered like traditional Medicare.
Medicare is a supplement to traditional Medicare.
Right.
In other words, when they first introduced Medicare, there were no Medicaps. There was no Medicare Advantage. There were no prescription drug plans. Okay? So you paid a deductible when you went in the hospital. You paid 20% of the bill for all your Part B costs. That's where the 80-20 rule comes in, that many people are familiar with.
But what I mean is, Medigap is private insurance, and medical advantages are also private insurance. So the difference between them, why is it stricter for Medigap? Because it covers more?
It gives you more freedom in your choices, okay? Not sure I know how to answer that. They both are supposed to cover a lot of things. Think of it this way, Medicare Advantage is pay as you go. The Medicare, original Medicare with a supplement is a box of coverages, okay? I mentioned about the woman with the infusion, okay? She was on a Medicare Advantage plan. It was pay as you go. She had a 0 premium plan, but all of a sudden, the cost of keeping it became prohibitive. So, HMOs typically are for healthier people. Okay? I don't know, there's no
So
good way of
she-
explaining that. Let's just say that if you're looking at the Philadelphia market, a lot of doctors don't take Medicare Advantage plans. If you're looking at the Pittsburgh market, everybody's part of UPMC or Allegheny Health. I was talking to a broker up in Punxsutawney a couple months ago now. If you go into a hospital, the Medicare Advantage plans up there charge you $250. That's it. Done. The same plan here in Chester County would be $279 a day for the first 6 days. Okay? A Medicare supplement, okay, that's $1,600 and some dollars that Mary had up there, okay? That's covered by every supplement plan, so you would never pay that.
Once you met that.
No, that $1,600 is covered by all supplements that are sold in Pennsylvania. So, it comes down to, if you're healthy, you're never gonna get sick, Medicare Advantage is the way to go. I don't know if that makes sense or not.
Makes sense.
one question from chat, and then we need to wrap up because the library is closing in 15 minutes. Is it correct that if you switch from original medical with medical plan, that's how it's written, to a Medicare Advantage plan, there is no eligibility penalty for pre-existing conditions?
Correct.
Okay.
Okay, there's no,
And we use it for this though,
you can always switch from
Oh.
a supplement to a Medicare Advantage.
okay.
Okay? Supplements have enrollment periods that are free, they're called initial enrollment period and special enrollment periods. I talked about both initial enrollment, the 7 months around your birthday, supplements are like when you retire, generally speaking. And one thing that came up about Irma, which I want to address before we close here. They do a 2-year look back, as Harry said. Right? A lot of people end up in a situation where they take a buyout from their company to leave. Okay, they might be 63, 64, 65. So they collect their final bonus and a buyout, and it kicks their income up over that $203,000 level.
Wow.
Okay? They do a 2-year look back, so 2 years later, in December, you get a letter. Typically, those letters go out in December. Okay? And it says, you are now going to be paying a penalty of, let's say, $59, okay? Because you made, and it's stepped. It's not linear. So you're gonna now be paying that. You can fill out a form, SSA 44, okay? And basically, it's a change of life event. You put down, no longer working. And it'll ask you, what's your income in retirement? And you put down 40,000, 50, whatever, you know, as long as it's below that level. They will then surprise you. Okay? Your Part D penalty, they will send you a treasury check for. Okay? Because it takes about 7 weeks for them to process it. Okay? Your Part B penalty, though, all of a sudden, they're just not gonna be taking it out of your Social Security check, and you can't figure out why, okay? But that's what they'll do. They won't tell you. Okay.
Great, Harry, David, thank
Can
Can
you
we
so
get
much.
5 people to fill out a
In
form?
the final minutes, I've got a